Hi, everyone. I'm Dr. Vic from Ninth Avenue and Midtown Dental, and I'm here with our clinical team. And we had some questions that we wanted to answer. So, the first question is for Chris. And in 30 seconds or so, Chris, could you answer what people need to know about it for people that are missing their hygiene intervals, either 3, 4, 6 month intervals?
Yeah, the most important thing for you guys to be doing right now is just keep up with your brushing and flossing. Try to brush after each meal, try to get the flossing in there. I know if it's not a part of your regime right now, try to work on that. Maybe consider getting an electric toothbrush if you don't already have one, maybe even a water pick if the flossing really is a no-go, and just use a fluoridated toothpaste.
Awesome. So I'm Dr. Amit from Ninth Avenue Dental, and Ziana, I wanted to ask you about what we should be doing to take care of our teeth while we have these different oral habits now that we're at home all the time.
Yeah, so a lot of people have a lot more time on their hands, which is great. So people are going to be home, they're going to want to snack, which is fine, but also making sure you're keeping your sugars, your carbohydrates, your acidic foods all to a minimum. These all have a bad effect on your enamel. And also just it might be tempting to snack. You want to make sure that you are snacking at the right time of the day. So before you go to sleep is not a great idea. You want to make sure you're snacking preferably right after a meal if you can, and have it with water or have water right after.
Okay, perfect. And what about stress? Now that we're under a lot of different new stresses, surely how should we be looking out for our teeth now because of the changes?
So stress is something I think we're all dealing with in different ways. Sleep, especially, either you're getting a lot more of it or maybe you're getting none at all. One thing that stressors do typically is clench and grind more. So if you're not wearing your night guard, make sure you're putting that in. And doing anything that you can relieve the stress. Maybe spending more time outside with your kids, going for a walk, taking a nice hot bath, could also help relieve the stress and maybe alleviate some of those problems.
Nice. Thanks, Shirley. It's Dr. Amrish. I want to ask Alicia, what about just home care for teeth and gums for our kids? We're spending tons more time with our children these days. So what are some cool tips there?
Yeah, so I mean, being at home can be challenging for you and your kids. Make sure that they're brushing in the morning and flossing and then brushing at night before bed. Make sure you watch them either in the morning or at night and help them if they need it. An extra tip is you can give your child a dry toothbrush while they're watching TV, so that they can brush and remove some extra plaque. Limit the amount of sugar intake during this time. Keep it to once a week or as a treat if they complete a task for you. Make sure your kids get enough exercise and playtime outside, and the weather should be beautiful, so that should be easy.
Awesome, thank you. And thanks everybody for replying to our last video. It's great to hear what people are up to in the community these days. And with the weather turning nice, it's awesome to get outside. And I think one of the treats that we're all craving these days is ice cream. And I wanted to just highlight one of our local community ice cream shops, Village Ice Cream, and they're open for curbside pickup. So it's a great way to get out there, enjoy some ice cream, and you've learned tons of tips from everybody today how to enjoy ice cream while still taking care of your oral health. So thanks a lot. Stay safe, stay healthy. Bye.
Bye.
Bye.